A big hello to our dearest students, nearest to our heart and soul. Warm welcome to all of you to the Psychological Booster for Mrcpi Osce November 2022. Hello, Chin. Hi, Tamina. How are you guys doing?
Good morning, everyone.
Good morning. Hello. Hi, Tamina. How are you?
Hi. Hi.
Thank you so
How are you
much.
all?
Yeah, thank you very much. Can you both sense, Chin, Tamina, the heartbeat of the student is like more than 120 today? Yeah.
Definitely.
Why this always happens that before the exam we are like, oh my God, what's going to happen? No matter how well prepared we are, it's some sort of an anxiety at the back of mind. Everything is going wrong for me. Oh my God, where's the hotel? What about the breakfast? What's going to happen on the exam day? What do I need to carry? What would happen in the waiting time? Lots of things in mind, and we are getting nervous and anxious because of bombardment of those thoughts, isn't it, Chin? What do you say?
Yeah. Regardless, no matter how much you prepare, you always feel inadequate. And that's just very natural because we are humans, regardless how well we are prepared. But you all have the weapons to go to this war and you win this battle, no matter what.
Yeah. And you know what? This is pretty natural. I say that adrenaline, which makes us efficient, I always love it because that's like from the physiology that it has to be a little faster because we need to be a little anxious. But that being anxious and uncomfortable, that affects your communication. Definitely, we are concerned about that. And why are we meeting today? To tell you guys that being anxious is pretty much understandable, but don't let it affect your performance because that's what we had been working for. Hello, Amrita. Hi, Farah. Hi, Fozia. Hi, Noura Ala. Big hello to all of you who have reached Oman, who have reached Ireland, and the ones who are going to reach today. Hello, Sarah. Hi, Rabia Mehboob. Big hello to all of you and the ones who are going to listen to the recording. We are here to tell you guys that you are all set for this OSCE exam. You are all prepared for this OSCE exam. It always seems to be impossible until unless you get the result that it's done. I'm yet to listen to any student after exam who doesn't tell about, oh, I did this wrong, ma'am. Oh, I forgot this, ma'am. Because it's very much natural to feel this way that you are understanding that, oh my God, the things which I've missed were those things which I had to speak. And we don't remember the good parts. It's very natural that we don't actually remember that what did we do good. We always remember what we missed. Yeah. So we are here today to generate positivity, to give those feelings in you guys that yes, you can do it. You're all there, and there will be another meeting when we will be celebrating the success. What should they do now, Jen? Tomorrow is exam for, I think, 10 of them. Rest are on Saturday, and almost all our Irish students who are appearing in Ireland, they are on Saturday. What do you say? What they have to work upon now today?
Most importantly, keep yourself calm, keep your thought together. Okay, do not read any more new things or new material or new stuff. I know, the tendency is always to discuss about something new in group, and that's very natural as well.
Yeah.
And most importantly, 24 hours or 48 hours before the real exam, adequate sleep and adequate hydration is the utmost priority. So that's the most important thing. Sleep is very, very adequate, at least about 8 to 10 hours of sleep. That's very important because you have to have a very, very clear mind when you enter the exam. You cannot be clouded. There shouldn't be a thought block, and it has to be very crystal clear so that everything will just flow out naturally.
I always say that it's basically, again, a human nature that we get anxious and we have lots of thoughts. Because of those thoughts, we have this anxiety and we cannot sleep. Tell yourself that sleep is equally important. You know why? Because today, your sleep is going to help you tomorrow, bringing up even that information, which you guys discussed maybe maybe a year back. Yes. Any reference which Chin gave you, I mean, a year back, Tehmina gave you an article, maybe 6 months back, that would be coming up in your thoughts, because the old memory works when you're easy, when you're comfortable, when you're at peace. So these things are so important. Maybe at this point you feel, no, reading another article is more important than this. But believe me, we, out of our experience, we are telling that all the things that come into your mind, and as Chin is saying, at the moment, super important is that you don't have a cloudy thought, that you are not having a thought block, because your speech, your continuity of speaking, your ability to justify yourself is what we need in the OSCE. Therefore, the first thing is, I know it's a new place, you have been traveling, but tell yourself that I have to sleep in an appropriate manner. Why? Because that would help my memory, that would help my non-fumbling speech, that would help my mind thoughts and my continuity of the speech that is going to be collaborated with it. Otherwise, it's going to be a gap that would definitely affect your confidence when you are basically doing the presentation. All right. Nobody is going to help you on that day. Nobody is going to tell you that you have to do it, because you people know it, that it's only you who have to push yourself. Why? It's your exam. You had been doing so many effort to reach at this place. Fight till the end. If one or two circuit stations, they go wrong, it's absolutely fine. The last 3, 4, if they go good, you have all the chances to pass. So you just have to tell yourself that I will do it. It's important for me. I've reached this place after lots of efforts, lots of finances, lots of administrations, lots of definitely the sacrifices of the family, you yourself. You have been juggling between all these. Today is the time that I just need your confidence. Please take care of your diet. Take a slight walk. Nothing is impossible. This exam is doable, and believe me, Tehmina, you would agree that they are over-prepared for this, correct? The
Yes,
way,
I totally agree.
yeah,
Yeah, because you already 2 times finished the recall with everyone, and
exactly.
with you all the uh, advices, I just want to add one thing, that
Yes,
why you will take stress, don't take stress, because you are going to see your friends. All you are studying together, but you
really.
don't know their face, nothing. But when you saw that you are one family there, when you find everyone that yes, we are studying together, then you will not feel stressed just before that. So don't feel like that you are going to exam. That just
Exactly.
think like that
Think
you
that
are
it's
going to
another
meet
day of
your
the
new
study
friends.
group. Yes, it's
Yeah.
another day of a study group, it's another day of practice.
Yeah.
You feel yourself that you're going, and believe me, the way we had organized the last 30 days and the way we had settled all the exam stations for you, people, they do very haphazard preparation. You people had been doing in such an organized manner, and now doing repeatedly 2 times, everything is solved with you. Maybe 1 or 2 stations I'm expecting from the recent talk articles. It's absolutely okay. No worries. You won't be blank. You people have been practicing obstetrics and gynecology. You people have your basal knowledge as well. What they want to see is that you are confident.
Mhm.
So remember to have relaxation in the last moment. Don't get panicky. So you know that you have to sleep, eat, and exercise in terms of a slight walk. Boost yourself at the moment. You are going to absolutely do best in your exam if you adjust your mindset. You are sitting in this OSCE exam for nothing but being successful. If you tell this to yourself, nothing is going to be a problem. But for the last minute tips, I have to tell you, please take care of the timings, specifically in this circuit. Do justify the things. So last minute tips from Chin, Tehmina, and me, myself, for the long case. Everybody, please pay attention. Chin, please tell the last things which they have to take care just to be successful in their long case, please.
Yes, again, like what Dr. Ali has said, you all have the equipments, Dr. Tapina as well. So very importantly, like I said, if you remember my very first session with you or the long case, I always said that this is about a game. So most importantly, you have to keep calm and play the game because it is just another day. Don't treat it like as an exam because you'll be fumbling, you'll be feeling nervous and anxious about the whole thing. So it's just about going into the exam. You have all the necessary equipments with you, and like what Dr. Tamina said, you are all very over prepared. You have done it 2 rounds. You have all the basic foundation with you already. So you just have to play the game, play as it will come along with you, and you will win. You will succeed in the game. Okay, so and always remember, whatever you always listen to the actresses, always listen to the examiner carefully. If you're not sure, ask them to repeat. Sorry, can you please repeat yourself again? So don't feel hesitant to ask because just that you assume that somebody is saying something that's what is formulated in your mind. And always, whatever you say, every sentence that come out of your mouth, you must justify it. Then you know that you're playing the game right. Okay.
Absolutely. Tahmina, for the long case, what do you say they should keep in their mind? Many of them are appearing tomorrow and many of them are appearing day after tomorrow. What's those last things as per the checklist for the long case they have to do?
For the long case, I just want to add it with Dr. Chin that you have to think that is 25 minutes, okay? But try to do very fast taking history, but you have to take full history, not think, okay, I will take little history and important one. No, in long case, it is not like that. You have to take full history, but within very less minutes, not like this 10 minutes or like this, because in 10 minutes you have to finish the taking information gathering, plus you have to summarize sometimes you have to summarize the cases, and then you have to do examination, and also that examination, you do examination findings, you have to tell to the patient examiner. So try to do this within 12 minutes. That is my advice, because they will get 10 minutes to talk with you. They have more questions in their mark sheet. If they can ask that question, long case is very easy to pass. But if you take time more in taking history or taking examination, everything, then you have less minute. Most of the time you will say 25 minutes, very fast it will go. So try to manage this timing. It is very important for long case that someone cannot get time to for viva, but it is very important that you did very well taking history. You examination is all are okay, but you cannot get time to viva. So do not be too stressed, because it is 25 minutes. It is a very long time, but when you go to start the long case, but you make your timing that I will finish with it, this timing, the first information gathering, then examination, then I will talk with the examiner.
An important thing which you have to remember is that, see, do a good time management, because there are going to be 2 examiners and you're going to be marked on the discussion of the topic as well. As Tahmina is saying, history, examination, yes, even if you tell about that these investigations I would like to have, these contain score. But definitely, if it's an endometriosis, then discussion about the endometriosis, because the examiner would have some set of directions that he wants to assess you upon, maybe the management part, maybe the differentials, how do we rule out these? All these things you have to take care of, because then it contains score. So give a good amount of 10 minutes, the last 10 minutes for the discussion. That would only happen. You all are very fluent in the history taking. Summarize the history, do the examination steps. If positive findings are there, the way we have coached you, the same way you're going to just explain your examination and then come to the discussion part. Please ensure that whatever you're saying, just don't say it. Please justify. I am going to have the blood complete picture because, or I want to see the hemoglobin or the total leukocyte count and the platelets of my patient. Any statement you make, justify. I would like to have a transvaginal ultrasound first to see this. Don't stop your sentence on telling about the investigation or anything. Anything you're saying, please justify. Because I want to rule out this. Because I want to evaluate the patient for this. This would give you the score because they want to assess you on your clinical acumen. They just want to assess that how do you approach a patient to have an assessment that you take a history, you do an examination, you've got a list of differentials in your mind, and how do you narrow down to reach to the diagnosis? If you understand this concept, your long case is going to be super easy. Tehmina, you were saying something. Yes, my dear.
Yes, about the long case, sometimes they will make you forward that Dr. Chintel is yes, is correct. And also sometimes if you speak, I told all time that you just follow the templates, you just follow the one by one what you will tell. That what Dr. Sidra is also mentioned that. And when you talking like this way that you are not haphazard, not sometimes telling this, sometimes telling them not like that time they will stop you. And they will tell you, okay, you go the next, you will go the next. Like this, sometime in examination also, if you stepwise you will do the examiner, they will stop you. So just try to do this stepwise and one by one, not go haphazardly first to tell this. No, just go the template wise and step by wise. Then they will stop you and they will happy to talk with you.
All right, perfect. Now, long case is going to be the second part. First, you're going to have a circuit. Again, I want a very good confident attire in the circuit, please. The only thing which I have assessed in the mock exams, and I'm sure Chin is going to second me and Tehmina also, that at times you people have got a lot of information. For example, it's malaria. For example, it's coarctation of aorta. For example, it's a mitral stenosis. You see, you've got lots of things in your mind. You know the entire talk article for the cardiac problems. But the problem is that if you don't listen to the question and you start giving the answer, what you know, you might not match to the examiner's key. Please take care of that. Listen to the question very carefully. What do they want? If they're asking about the history, tell about the history questions. If they're asking about what investigations you would like to do, tell about the investigations. Let them ask about the treatment plan. If from the start they say, how would you manage this case? Please remember there would be 1 or 2 stations saying, manage this case after giving 2-3 lines about the case scenario. That should include your history, examination, investigations, and treatment. Management words include all this. Am I clear? Did you guys understand this, please? Give me a thumbs up in the chat box that you guys are with me, because circuit is going to be very easy for you guys. Many of you have taken the Mrcpi Osce. Many of you have taken the Mrcpi Osce. For you guys, it's not a trouble. The only thing is that you guys understand that the basics of the circuit, like few of the students under the nervousness, they just forget the greetings. Hello, I'm Dr. Rabia, one of the exam candidates for today. I've read the instructions and I'm ready for the structured discussion. Greetings, they contain score. Even if you have this greeting, believe me, I have this evaluation somehow as a human being, of course. If you do some sort of a mistake as well, and you say, thank you very much for your time in the end, and then you leave your station, that definitely adds on a score. Why? Because they're looking at the complete attire. They're evaluating you head to toe, that how good you are in terms of your handling yourself. You know, we get nervous, we get pissed off, and we just miss out the things. But you should not forget the basics. Do not forget to greet the examiner under nervousness, please. Once the station is in front of you, see the station, take, a 15-20 second pause, evaluate that what you're going to say, organize your thoughts with full confidence, start the station. As Chin already has mentioned this, I would like to emphasize on this again, that if you don't understand any question, please do not hesitate to ask. Can you rephrase the question for me? Or can you please repeat the question? It doesn't harm, rather than going in a wrong direction and answering it in an incorrect manner. Chin, what would you like to add on in the circuit tips, my dear?
Again, importantly, the etiquettes of it. Again, this is a very easy mark, a free mark. It doesn't require any scientific knowledge or anything like that. So basically, talking in a calm volume of voice, being polite, your body language, and also how empathetic you are with the patient in the Breaking Bad News station, for example, or delivering some cancer news to the patients, and how empathetic the rapport you are with the patient or the examiner, whichever sort of station that you're getting, and whether they would like to see you again as a doctor. So these are easy, and it differentiates you between a failing candidate versus a passing candidate. So these are all easy scoring point, which does not require much effort from your side, and it should come as a second nature from you. Yeah,
correct. Tahmina, anything important they should keep in mind before they just plan the circuit in the morning and they just leave for exam?
About circuit, I would just want to add with you all. Just there will be, Dr. Sidro also informed that there will be 1 or 2 cases. Mostly 1 cases may be new. New means that like this, one time came malaria, one time came female genital mutilation, or another time came that cardiac disease. That that is not like that. It is very extraordinary or any new disease. So when this type of one case come like that, don't be stressed or don't be think I don't know. Like that one time episiotomy like this, that is not episiotomy, that is come that perineal there is some infection. So when this type of only like this, you think that is something new, just try to do like that stepwise. I just telling like why, because when you will start with okay, I will take history, then I will go for examination, then investigation and management, and like this way, when you go for management, one point, don't more details, not go more details, that one point, just try to shortcut it and just start it and try to finish it. When you finished like this way, then they will ask any extra question they have, they can get time to ask you. But if you talk one point more details, then you have no time to, the examiner to ask. The examiner will be telling, okay, manage the patient. Most of the cases, about 2-3 cases that will come, that manage this case, how you can manage. Just the one question, but maybe they have more question in between, like this sterilization, fibroid came. But that is not only fibroid, they ask about infertility more. So not
and they
ask
can go
about
to even
the
myomectomy steps, even that, yeah. So they can have their own list of questions.
Anything. Yes, anything can go, but you have to, within 5 minutes, within 3-4 minutes, you try to finish the exam, history, examination, even investigation or some management point, you have to inform. Then they will ask one question, even they have 3-4 questions. If you can answer that, then you can pass very easily. But don't, I just try to tell you 1 point more, that don't try to tell 1 points more details.
Actually, the problem is that I felt when evaluating the students that we all know, for example, if you just put forward a topic GBS, right? So they know so many things of GBS. So they try to, quickly tell everything which we know. What we have to understand is that they have got a set of mark sheet. If we understand that, they don't want you to, tell everything which you know about GPS. That's where the problem comes, that you start telling the things which you know. You have to understand that you have to speak up and ask about that what exactly they know in this, and they are actually analyzing you in this. Listen to the questions. What do they want in GPS? If they ask you about the intrapartum antibiotic prophylaxis, different indications, listen to the question, answer that question, then give a pause. They would definitely understand that you're done with it, and they'll come up with the next question, because the key is according to the question. Please try and understand this point. That's very, very important for you guys. Are we clear, please? Yes, exactly. Yes. So everybody clear? Amrita, Farah, Rabia, are you guys clear? Please let me know, is any questions you people have in the last moments which is disturbing you guys, anything for the administrative aspect, anything from the curriculum aspects. You people can ask your questions so that we can settle the queries, and today we all have a peace of mind with that. You people practice, please. Yes, everyone, please. Rabia, anything
Hello,
disturbing?
ma'am.
Farah, hello. Yes, my dear.
Good morning. How are
Good
you?
morning. I'm fine. How are you doing? And how is the morale?
Alhamdulillah, fine. Morale, I don't know. I'm so confused.
No, don't be
Because,
confused.
not much
Very-
time, so I don't know.
I can totally understand. But don't worry. After Mrcpi 3, it would be an easy one. I know your baseline knowledge, my dear. Okay?
Doctor.
So nothing
Inshallah.
is going to be a
And
trouble.
for me, the only benefit that I booked my exam, because for me, it's a home center. It's my
It's a
hospital that is
local one.
conducting.
Correct. All right.
And,
So you just
and
have
it's
to
in
carry
my
on.
hospital.
Yes, that's perfect. So that's something like your daily routine, yeah?
Yeah,
that's-
it's like my home.
Yeah. So hopefully everything will be fine. Thank you very much for guiding everyone in the group, because the people who have reached Oman, they're a little, of course, anxious. So thank you for helping them out. And whenever they're asking something, I just tag you there, because I know you'll have some answer to the hotels and all the details because of
Don't
that.
worry. Actually, Royal Hospital is quite simple, and it's
Yeah.
only one building. And because of the cardiac center and all, that is totally different. So hopefully they will not have any issue. And still, if anybody has issue, they can call me.
You can
Anytime, because I'm
definitely
staying here.
message Rabia, and please, she's going to help you guys because she is there. You people won't feel any sort of a difficulty, right? Anybody. Yes, please. So you don't require anything. If anything would be there, that would be the essentials would be placed there for which you require for the examination. All right.
Ma'am,
Okay.
just
Yes,
one
ma'am.
confusion I want to
Yeah,
clear
sure, please.
regarding cervical smear. When we
Yes.
are taking here in all videos, what I could see, like they are taking with the cyto brush, and they are leaving the brush inside the this one formalin. But here in Royal Hospital, we are using the same kit for taking the this one. Even the color is almost same. Only cyto brush, like that stick is green, otherwise the same. The only issue is that we are not leaving the brush inside. We are just keeping the cells. We are like just merging the cells in the formalin, and we are throwing the
You just
brush.
dip it and
So
take
what's
it
the
out.
protocol? Yeah, what's the
So
protocol? Should we leave the brush
Chin
inside
is
or?
the best person to answer this. Anything related to colposcopy and
Yes.
cervical intraepithelial neoplasia. Yes, Chin, my dear.
Yeah,
Yes.
so according to the BSCCP RCOG standard, so what you would do is after the sampling, after the correct sampling of turning 360 degree, so yes, you will actually submerge the brush, the end of the brush, into the formalin containing bottles, and then you will take it out for a minute. Basically, you submerge it so that you mix it together, and then you throw the brush away. So you don't send the brush together into the cytopathology laboratory. So that's the correct practice. Okay.
Got it?
Yeah, that's what I was asking, because we are not keeping the brush, but in all videos I was seeing the brush, so I was a little confused.
Okay. No, you
You
don't
can give
send
the
the brush.
reference as well of the recent recommendations. Okay. Yeah, Rabia? Okay, that's
okay,
perfect. All
doctor.
right.
And
Yeah.
the other thing is that after taking the this one cervical smear, first we have to keep the brush, or we have to take out the smear, because it's take out the speculum, sorry. Because usually in clinical practice, what we are doing with one hand, we are keeping the brush, and other hand we are taking out the speculum. But what is the exact protocol?
So if you have already completed, if it's the task is, I mean, even in real life, if the task is just to take the sampling from the cervix, then you just you can remove the speculum if you don't need to examine the cervix further. So because it's uncomfortable, so you don't have to leave it there unless after like in colposcopy, after taking a cervical smear sample, if you need to examine it further or if you need to take a biopsy, then of course you leave the speculum there and then you can proceed on after the sampling. Yeah, is that clear, the step? Yeah.
Yes, it's clear.
Yeah.
Thank you. Thank you, Dr. Sidra.
Hello, Dr. Sidra. Hello,
Yes, my
good morning.
dear. Big hello. Good
Yeah,
morning. How are you?
yeah, I'm fine. Thank you. Dr. Sidra, just
Okay.
one more time, just
Sure,
explain me
please.
that I understand that a long question has they are arranging the two examiner, and we
Yes.
have to examine with the dummy and then we have to give viva to them. And what about the short 7 stations? They have like the same MRCOG, the candidate will be sitting or only the examiner will be there?
Absolutely same. You will have the examiner sitting in front, and when examiner is sitting, then it's only the examiner discussion going on, right? So basically that would be a viva. That's a structured discussion. You can just stimulate it to that of MRCOG3, okay? There would be a case where 2 people would be sitting. So you'll have a role player. That would be only one. One
Okay,
out of 7.
communication with the role player only one.
Yes, only one where the role player is there. So here only one station assesses your communication, contrary to that of MRCOG3, where we have got only 4 structured discussions out of 14 stations. So here only 1 out of 7 is going to be a simulated patient task, and there 2 people would be there. The examiner would be quiet, might not interfere. The role player, you'll start your greeting with, hello, I'm Dr. Amrita, one of the doctors in the antenatal clinic today. So may I confirm your name and age? See? So that would be, otherwise your greetings and your discussion would be same as that of a structured discussion, that I'm one of the exam candidates for today and I've read the instructions and I'm ready for the discussion, please. Okay.
Okay, thank you,
Dr.
Dr. Sidra.
Sidra, communication
Yes,
skill, what it means, like one is a simulated patient task.
Yes.
And
one would be the
five-
labor room. Rina, one would be the
will be-
labor room.
Yeah.
And
And
rest of the 5 are also going to be structured discussions. Generally, the pattern had been, if you see the recalls which we have assessed and, organized for you guys, 3 to 4 are always Irish recommendations. Like they're very fond of fetal growth restriction, the NTD, because these things are a little different. So they definitely, the 41 Irish guidelines, 2 stations are definitely from the Irish guidelines.
okay. But most of the guidelines are the same as the RCG as advised.
7 guidelines, I always say that we have to do separately. Rest are almost the same, yes. But my suggestion always is take your 40, 50 seconds. Why? Maybe 20 seconds for reading, but don't just jump to the discussion. Organize your thoughts in 20 seconds, that, okay, this is how I'm going to start, and then start. Because rushing through it makes an invitation to fumbling, which definitely is not suggested. Okay, so read it in 30 seconds. Chin wants to add something. Chin, my dear, yeah.
Sorry again.
Yes, my dear. Farah wanted to ask about the 10 minutes time which is there. So how much time should we take for reading generally?
Generally, in between station, you have about 2 minutes to read the station as well before entering into the station. So make use of the full 10 minutes to either talk to the simulated patient or the examiner. So I think that 1 to 2 minutes is essential between transferring between station 1 to 2, 2 to 3. So you have that privilege of time.
Yeah, it's
Farah,
written in the email. Yeah,
Okay,
it's written in the email, Dr. Sidra, that 2 minutes, there will be a
perfect.
break
They
of
give
2
you-
minutes between each station.
That's perfect. If they give you, that's awesome. But if it's not given, even then that's not a problem, because that would be with you inside. Okay. So the discussion would be, because it's not a simulated patient task. Most of them, only one is there. So it's absolutely fine in terms of, settling the queries. Okay. Yeah. So let the examiner come up with a question, answer the question, give a pause, and then you're going to start up again. All right.
Okay. All right.
Dr.
Thank
Sidra,
you.
Yes,
one
Reena, my
question,
dear.
they send me email. They will first in the morning is my long case. They didn't assign me any OSCE station. So when I will go after the long test, they will assign me for the OSCE station circuit.
Yeah. So I just want to add on to that. So basically, you could start with a long case first, or you could start with an OSCE first. So it's vice versa, and you be interchangeable just because of different groups and different quarantine groups, basically, just to avoid the question being leaked out during the day. So that depends, okay, whether you get a long case first or an OSCE circuit first. Yeah, so it
If I
doesn't.
get, yeah,
Mhm.
if I get a long case,
Mhm.
after the long case, they will assign me the OSCE circuit.
Yeah, exactly. Exactly.
And
Yeah, but it will be a different session. It's either morning and or afternoon. So you get an hour break in between. So not to worry about that.
okay, thank you.
Mhm.
Any other question, friends? Hannah, Bruti, reach safe and sound? Yes?
Hello, everybody. This is
Hello,
Sarah.
Sarah. Hi. So you are
Hi.
already in Oman, friends. If anybody
Yes.
has
Yes.
any sort of a confusion in terms of the hospital or any sort of an administrative guidance needed, you can get connected to Rabia or Sarah. Both of them are in Oman and they're there to help you guys. Yes, Sarah, my dear, you wanted to
Yes,
say something.
anytime. Yeah, sorry, I joined the group very late, but actually your sessions were very efficient and alhamdulillah, hopefully it is inshallah of a great help as always.
That's
I
okay.
just need to, I'm not sure if question might be a little silly. Just when I enter the Viva stations, should I greet the examiner first or just sit and be quiet, like wait
No, greet with
till
them.
he starts?
Greet. Greeting is must. When you enter, you have to greet.
Okay,
Okay.
thank you.
Greeting is something which is always suggested.
Okay, so just hi, right? Till the it means
You're
or
if I'm not wrong, you're asking about like for the circuit, right? Like from moving
yes,
from one
for the
station to
circuit,
the other.
for the circuit, yeah. I mean,
And you have read the instructions already outside, right? So you're going to say, hello, I'm Sarah. I'm one of the exam candidates for today, and I'm ready for the structured discussion. I've read my instructions.
okay, so I'll start from here. Okay,
Yes,
great.
from here. So then
Thank
they're
you.
going to ask the questions. Okay, so this is greeting. Okay.
Okay.
Hi, Dr. Pura.
Thank
Thank you so much. And
Hello.
safe and now in Oman. Yeah.
Okay,
Tomorrow.
that's perfect, my dear. Take care of your health and stay calm. You people are very well prepared. It's just another day of speaking and just work on those last minute points which I've given. You people would do great. Thank you so
Sure.
much.
Thank you so much.
Thank
Thank
you.
you so much.
Any questions, friends? Anything you people are still having? Saima, hello. Quiet girl.
Assalamualaikum.
Alaikum rahmatullah. How are you? How is
How are
Quran?
you? I'm
Yes.
fine. Alhamdulillah. It's okay,
That's
doctor.
good.
I'm traveling
That's
tomorrow,
good.
inshallah.
Do
That's
it.
why
You
I'm just
have been
listening.
Yes, you have been studying hard, and we are so sure we are going to celebrate, and you're going to have
Inshallah.
this wonderful, wonderful celebration for all of you out there. Yeah.
Definitely, inshallah.
Thank you
Yeah,
so
Dr.
much.
Suraj.
Thank you
Sure.
so much.
Thank you.
Dr.
Thank you so
Sidra,
much.
Yes, my dearest.
one question that like in the MRCP station, are the short or long like a MRCP, because it is hard to finish in
Generally
that.
small, but if one or two are long, don't worry. You have been trained so hard with MRCOG3 that this is going to, you'll feel it to be
Yeah,
easier.
but I don't know. This time I have a too much palpitation. Maybe it is a difficult. I travel from the Portugal and then the short time for the
Reena,
revision.
you're amongst those, you, Sheila. I've got so many students who took the part 3, then Portugal, Epcot, and then Mrcpi Osce. Can you imagine? So there are 4 to 5 students of my Mrcpi who are taking back-to-back these 3 Osces, and they're saying that, ma'am, what to read, we don't know because we are in plane only. You know, landing up at one place, taking an exam, and just again going back and then landing to the other one. So I know it's quite tough, but it's absolutely okay, my dear. Pooja, I have trained you for so long now, and I know your basal knowledge. For you, you just be yourself and you speak out there. It will be done for you. I know. Because see, you're not blank. For even Epcot Osce, you have been studying with us. So you know the things. It's just like you just be yourself and just stay confident out there. Okay? Don't worry that I have been traveling, I didn't study, because what you had been studying for months and months for part 3, then Epcot, and then MRCPI, more or less, they're the same things. Only the patterns are different. Okay? So don't worry at all. Just have this faith in yourself that you can do it and you're the best out there.
Yes, this is I
Okay?
am doing. Yeah, thank you, Dr. Sidra.
All right. Thank you very much. Thank you. All right, friends. So any further questions? Hello. All right, Sana is here. Okay, so you people are confident for any questions for the exam point of view, please?
Yeah, Dr. Sidra,
Yes,
just
my dear.
yeah, just can you tell me that confidential maternity mortality inquiry, that CMAC, that the only that much we have to tell, like related to the COVID or what the
What
direct.
Tamina has posted in the end, that was fine, but the recent one also give a look. But generally, it's a very old exam station. It's not been coming recently. So hopefully would not be repeated. But if as in one odd station, it does come, my dear, whatever is in the study group, that is sufficient, sweetheart. Okay?
Dr.
That's sufficient.
Sidra, I added the recent one,
Yes, sweetheart.
one.
I
Yeah,
saw that.
I added the recent
Do the
one in
summary
this
only.
one.
Yeah, do the summary
Yeah.
point. Okay? No need to go into details, 195 pages, no need to go into detail at the moment. Okay? All right, perfect. Thank you so much. All right, friends. So I would just like to tell you that, see, whatever we have been doing, today, everybody is in one straight line and everybody is like, equal, no matter somebody had been studying for like 6 months, no matter somebody had been studying for 1 month, no matter somebody has studied for like 2 weeks back when people, they still receive the acceptance from the college, right? Everybody is on one straight line. No one is better than other, because the person who would stay confident that day would be the person who would just ace it and would prove him or herself to be the best to the examiners. So we were meeting today to ensure that no negative thoughts from this point onwards, no thoughts of failure from this point onwards. The stress we have, if it reduces our efficiency, that definitely is, we need to take it out from today, because tomorrow is that day when we need to be at our best. Remember that you yourself, tell yourself that everything is well, and this wellness should overpower this stress. Let's think positive and let's be positive. We have reached Oman. We are going to the exam center, both in Oman and Ireland, to be successful. Nothing but successful. You just keep this positive attire from this very moment, and you all will see that miracles, they would happen. Definitely, yes. Your positive attitude, your optimistic behavior, that would result in the desired actions, and that would definitely lead to success. Now is the time that we have to act. We have to speak with confident attire. We have to justify what we are speaking. Let's focus, stay composed. One more request, please. I know many of you in the study group are in Oman first day, Oman second day, Ireland on Saturday. I would suggest do not talk to each other prior to the exam. After the exam, you can sit together, you can party together, but before exam, adding on to, one simple statement of any student, oh my God, what was the 4th point in the CMAC, and you'll be stuck up there. That why at this very moment, I'm just going to start my circuit. So my suggestion would be staying quiet before exam, because that maintains your focus. Better the focus is, better would be your ability to reproduce the thoughts when it comes to the circuit. So after that, you people can meet, you people can greet, you people can party. But my suggestion as a mentor, as per my experience, that do not invite anything that adds on to the stress before the exam. All right. If you just follow this, everything is going to be perfect. Thank you very much, Sarah, Amrita, Fawzia. Thank you very much, Chin. Thank you, Tehmina. Some last words for your students before we call it a day. Yes, my dear Chin, your last words for your beloved students.
Yeah, to everyone here, first and foremost, thank you from my side and also from the whole entire team of RFA Tutor. So all my best wishes go to you out there, and I'll be praying a lot for all your success, and we will all celebrate together.
That's awesome. Tehmina, what do you want to say to your beloved students?
Okay, my last word is, when you will go to an exam, you will think that you are going to your normal everyday routine clinic.
Yes.
You are going like that way. And you will see that all our friends and family like an examiner really they are very nice to you. I saw that they're very nice. So don't worry, don't take any stress. And yes, last thing, but Dr. Sidra also tell that don't be stressed, don't study that time, be focused and not ask anyone any question, because if you ask anyone, if she can answer you, you will think, oh, she knows me more than me. Everyone like that. Everyone, whenever you ask anyone, if they can ask any answer, you will think, she knows better than me. No, everyone you knows very well. So don't ask, don't focus only your study and not read that time, or yes, talk with it or any friend after the exam. Everything you will do after the exam. Good luck.
Absolutely. So after the exam, we would see in the study group, they all having, party together. That's absolutely fine. But before that, I don't want any single element to disturb your thoughts. So I want full confidence. So staying calm, composed, quiet, and having, just focus on the stations and tell yourself that I will do it. I'm the best. I have studied a lot. It's not that these 4-5 days only, what you have done in Obs and Gynae, that all is contributing towards your preparation. So let's pray for the blessings. Let's pray to the God, the Almighty, whatever the faith we all have. Let's raise our hands together. We have been doing efforts in our humble capacity. We are nothing and we can't take a step forward if we are not given the energy and the power. So we need blessings. All the prayers are going to be with you guys. May the best of luck be with you. May each word that comes out of you has the full power to impress the examiner. We would definitely be praying for those hours of your examination. We would see you successful. I just need your confidence again. I just need having faith in yourself. You all would make us proud. Thank you very much. Best of luck from the entire team of RFA tutors. And thank you for spending your precious time. The ones who are traveling at the moment, the YouTube link will be shared with you guys so that you can listen to the booster at the end of the day. I just need one sentence in the chat box. We will do it. Tell yourself daily, we will do it. And you people would see that we would come out successful. That's my girl. Thank you very much, Amrita. Thank you, Rabia, Mehboob. Thank you very much, Saima. With all these energies, with all these powers, may the Almighty be with you guys. Every single moment be blessed for you guys and your families. Let's come out successful. Thank you very much, Chin. Thank you, Tahmina. Thank you very much, back-end team. Love you all. Take very good care of yourself. Bye-bye from the entire RFA team. See you guys. Thumbs up, and we will celebrate again. Bye-bye. Thank you so much.
Bye.